I'm just waiting for my Facebook live to start, and then we'll go live here as well. All right, so I'm live on both places. And all right, so what I wanted to speak about today is diabetes. For those of you that don't know me, my name is Mugdha Pradhan. I am the founder of Thrive FNC, and what we do is we reverse chronic conditions. And hi, Savory Science. And we were working on a research paper on how the work that we've done so far in the last 2.5, 3 years has helped in reversing diabetes, and it's helped in reversing insulin resistance. And we were crunching data, we were looking at graphs, we were looking at numbers from all the patients that we've had so far, and I thought it's pretty phenomenal. And I just felt like coming and speaking about it today. So that's what we're doing right now. So, you know, even before I go into diabetes, I really wanted to talk about something. So yes, the lockdowns have happened. Yes, we've all heard about COVID-19 and Corona over and over again. But I actually have started looking at it, you know, this entire focus that's come on health. It's not such a bad deal right now, because what is happening with this coronavirus is it's somehow changing people's behavior towards health. In the past, you know, the only people who would come to Thrive were people who had either been diagnosed with some sort of a chronic condition, or who had parents who were really ill and who wanted some solution to that. But with COVID-19, with Corona, a lot of people have started, like, you know, health has actually become a mainstream topic beyond Bollywood and all of those things. So I appreciate that people's behavior towards health is slightly changing, though there is still a lot of fear, though there is a lot of mystery still, which we are here to resolve. That I would say is my job. But I really like what's happening, that everyone's really focusing on health and talking about health now. The problem, though, is all these conversations that are happening around health, especially in mainstream media, no one's really talking about what it means to be healthy, right? So people are talking about immunity, people are talking about respiratory viruses, people are talking about hospitalizations and all of that. But no one's really telling the general public about what it means to be really healthy. What does good health look like, and how that actually means that you are healthy metabolically. It's not just about you being thin, or you're having great skin, or you have energy through the day. Yes, those are all indicators of good health, but you could be thin and you could still have underlying diabetes or insulin resistance. So you could be metabolically sick internally and you might assume you're healthy. So the problem with mainstream health advice is they're just giving you really stupid things to do, like wash your hands and sanitize your hands with these alcohol rubs, without really, you know, giving you small tips. Like, instead of closing down gyms, if the government had really focused on making sure alcohol shops were not open, that itself would have been such a turnaround in people's health, right? So no one's really giving the right advice, no one's really giving the right kind of knowledge when it comes to actually taking care of health, and that's what we are here to do. So that's my biggest problem, that yes, there is an increased awareness about health, but no one's really there to give this advice on mainstream. And when I say no one's really here to give this advice, no one's really talking about how most Indians have like severe metabolic dysfunctions. Like, we are primed for diabetes genetically. India is the diabetes capital of the world, and we're all genetically primed for diabetes. And no one really is talking about that in mainstream media. No one's really talking about how Indians have so many levels of metabolic dysfunctions that make them prime candidates for any adverse event that happens to their health, right? So it's really sad that that happens, and that's what I want you guys to really understand, that we need to really take care of our internal health. So what does good metabolic health mean? It means that you have no insulin resistance, right? Like, your body is not producing extra insulin just to kind of metabolize the glucose that you're getting from your food, or your cells are sensitive to insulin that's coming in, because insulin is one hormone that can create a lot of inflammation in your body. And the cytokine storm, the ACE2 inhibitor, the receptors that we speak of in COVID-19. I mean, the entire system itself collapses and crumbles if you have inbuilt insulin resistance. So that's something that we really need to focus on as Indians, as a population, that we need to work on our metabolic health. Most of us have this underlying thing going on. And like that's what I discovered, like when we were looking at data, right, when we were crunching this stuff for our research paper, we realized that almost 98% of the blood tests, the reports that we received, almost all of them had insulin resistance, even if they didn't know it, even if they didn't know they were like going towards diabetes, not now, but 5 or 10 years from now, they all had this thing going on in their body. So there is a very, very high level of metabolic dysfunction going on in Indians, and we need to really focus on, resolving that, because this leads to diabetes, which then leads to other complications when it comes to your health. And why are we experiencing this metabolic dysfunction, this storm that has to do with how our eating habits change? There was an influx of seed oils, processed foods, how all of that came in and changed our primary food habits, and that is what is really creating a lot of health problems, that we aren't really eating the way our ancestors used to. We are eating very, very different food from what our body really needs to function optimally. So when I speak of diabetes, a lot of people assume that, carbohydrates or carbs are the root cause of diabetes. No, carbs are not the root cause of diabetes. Though if you're eating a lot of refined carbohydrates, like maybe you're having a lot of sugar and you're eating, like maybe you avoid sugar but you're having jaggery, or your meals are very, very high carbohydrate with not enough of a balance of fat and protein, what can happen is it can worsen insulin resistance. It can make it harder for your body to, absorb all the glucose that's coming in from your food. But carbohydrates are not the root cause of diabetes. They don't trigger diabetes. What really triggers? So diabetes is just a label, okay? So when your blood sugar levels go above an optimal range, the doctor tells you have diabetes. But what creates diabetes is something called as insulin resistance, and what triggers insulin resistance is vegetable oils, polyunsaturated fatty acid, vegetable fats. These are the things that really trigger diabetes in the first place. So carbohydrates are not evil. Carbohydrates are okay. Like I was saying, we were looking at numbers, we were looking at the data. We used to be plant-based. So Thrive's protocols were plant-based for nearly 2 years, and a lot of the data that we are working with right now is from that time. And that, like, plant-based protocols are high carbohydrate protocols. Despite being so high in carbohydrate, we have been able to reverse diabetes in a lot of our patients. So carbohydrates are not the root cause. What really triggers diabetes and insulin resistance are vegetable oils. So then, coming down to why did I start off speaking about COVID-19 and why am I talking of diabetes and metabolic dysfunction? So this thankfully has been covered in mainstream media quite a bit. If you've been following my Facebook posts, then you'll know I've been talking about this. But if you have underlying health issues, like if you have diabetes, if you have high BP, if you're clinically obese, or if you have any other health conditions going on, then the outcome of a COVID-19 infection is more likely to be fatal than in somebody who is not like that, right? So there is so much data, there are so many research papers that are showing this, that the correlation between metabolic dysfunction, which means poor internal health, and COVID-19 is very, very high. So while everyone's worried about the pandemic, while everyone's waiting for a vaccine, what would really work is, taking care of your internal health, of fixing whatever is going on inside your body. Because once that is fixed, it doesn't really matter which virus, which bacteria comes at you. You are going to be able to deal with it and get on with life. And this is one reason why we are seeing that even people who recovered from COVID are still, they have so much trouble getting up, getting back their vitality, getting back their energy, that they just aren't the same anymore. We've heard this from so many people, that they have no energy, they are having not really mental health issues, but like a lot of anxiety, a lot of brain fog that's happening. And one of the reasons why that's happening is an infection, especially something that's been blown out of proportion so much that out of fear itself you might manifest a lot of symptoms. An infection like that can drain your body's resources, so you might become deficient in a lot of nutrients. Plus, if you have insulin resistance, that's going to make it harder for your body to recover. So if you have metabolic dysfunction, if you have underlying health issues, either COVID-19 becomes really fatal, or even if you recover from it, it's going to be really hard for you to get back your lost energy, right? Which is why post-infection also, if you really want to take care of yourself, what you need to do is work on these underlying things. And we've actually done this work with a few patients now, because COVID's been here for a long time, and we've started getting in people who wanted us to help them with their health. And one of our patients actually was somebody who was hospitalized with a COVID-19 infection, who was getting sicker. And then the interventions we did with nutrients kind of brought him back quickly. He's back at home also now. And then we work with people who recovered but who couldn't get their vitality, and we are helping them also, become better. So metabolic health plays a big role. Like internal metabolic dysfunction plays a big role in not just your overall health, but how your response to COVID-19 is also. And that's the good thing. Like I said, there's always a good side to every story. So what I really like about what COVID-19 has done is it's exposed how metabolically unhealthy most of us were. It's really shown humanity across the globe that we aren't really as healthy as we think we are. And I think that's one positive outcome, that people really know that there's a possibility of any outcome happening if they've not taken care of their health, which is why so many people are afraid, which is why so many people are going on, complying with these moronic, absolutely draconian diktats like lockdowns and social distancing and all of that. None of them really help your health. They don't. What really helps health of a population, what really helps the health of a nation, what really helps the health of an individual is you focusing on what's going on in your body and you fixing those issues one by one. So yay for COVID, because it's told us the truth about where we stand in terms of health as a species. But thumbs down for the measures that were taken to deal with it. So to me, the question really is, given what I know about human health and given what I know about how people's health, like COVID-19 isn't really the pandemic, right? The real pandemic is diabetes, because if people didn't have diabetes, if people didn't have underlying insulin resistance, this would have been just another virus that came and went. It really is like that. Like if you look at the number of deaths that have happened in the last year on year, and you compare it to the number of deaths in 2020, in fact, 2020 deaths are much lesser, okay? So that's just another factoid that I'm leaving you with. But whatever happens with COVID, whatever fatal outcomes or serious hospitalizations or whatever happens, it only happens because people have underlying health issues, especially insulin resistance and diabetes. So the real pandemic is not COVID-19, it's just a virus that came one fine day. The real pandemic is diabetes and insulin resistance, and I'm wondering why nobody is addressing it as that. Why isn't diabetes being called as a real pandemic? Why isn't the government doing its best to counter that instead of trying to solve an issue of a virus? Like viruses are always there, they exist in our environment. Even before COVID-19 came, did you guys know there was something called as an Epstein-Barr virus, which we have seen causes so many health dysfunctions in so many patients? Did you guys know of a bacteria called H. pylori, which causes so many digestive disorders? So there are a zillion viruses on this planet, each with their own specific ways of affecting the human body. COVID-19 is not the only one that came. What is really making it serious for people is underlying health issues, and unless those are fixed, we are not going to see. A vaccine is not the answer. A vaccine is not the cure. The cure is fixing your internal health. And that's why I wonder why is poor metabolic health not being called a pandemic, right? Why can't people address that? But I mean, if that was addressed, we would not be such an unhealthy population. We wouldn't have advertisements for cornflakes and junk breakfast foods going on for kids and ruining their health even before they are able to talk. But that's for another day. So the question is, what should we be really doing, right? Like, should we be okay with more lockdowns that are supposedly what for our own good and they are meant to keep us safe and healthy? I think that's a whole load of BS. If the lockdowns had worked, if they had worked, we wouldn't have had any more infections, any more cases. Um, if the masks had worked, we wouldn't have seen the same thing happening. What I know works whenever there is a new virus on the block is something called as herd immunity, where people are exposed to it, it passes through you, it goes through you. If your body is able to deal with it, you deal with it, and then it moves on, and then the entire species as a whole becomes immune to a virus. That's the best way to create immunity to any pathogen, and lockdowns will prevent that from happening. Lockdowns are of no use when it comes to counter a chronic disease, because lockdowns, if you notice, a lot of people's eating habits became worse. We've had people from the Thrive tribe, people who've done work with us, people who got their health back, actually go through a more difficult time during the lockdown. On they signed up with us again because they said that, what happened in these 10 months is absolutely insane. We don't know what really started, when it started happening, how we started going downhill, but we know that by end of September, end of October, we were not in the same place that we were in March. So a lot of them actually came back and signed up with us just so that we could get them back on track with healthy eating. So that's not cool at all. I don't like people signing up again with me, because I feel like a failure if I've not taught people how to eat healthy in the first go itself. So this has happened with people who are already committed to their health. So imagine what's happening to people who don't even who've not even taken the first step towards taking care of their own health, right? So lockdowns have actually been the worst thing that could have happened to humanity as a race. And I'll tell you why, right? So it's not even just the psychological impact, it's not even the economic impact, because what the lockdowns have done is they've destroyed lives of thousands and hundreds of people. I was reading reports about how people in the US, people in the UK have actually gone, below poverty, and they've now become dependent on government schemes to kind of just get their basic food. How a lot of people have experienced food poverty for the first time, where it was making a choice between them eating or their children eating. It's stupid what these lockdowns did, and that is never the answer to true healthcare. We should in fact begin reopening society. We should in fact focus on educating people on how to take care of their health. That would be my answer. And the only other thing that I notice is, people want quick fixes, right? So a lot of people will think that they can save themselves if they wear a mask, or if they drown themselves in hand sanitizer. They wouldn't really do what it takes to actually take care of their health or the health of their loved ones, right? So there's this entire apathy towards making real lifestyle changes that would give you permanent and sustainable reasons. I don't know why that happens. I don't know why people have such resistance to doing the one thing that actually might create long-term, long-lasting change that will take you out of fear, right? So many people are afraid of a virus. I know of people who are not working out in gyms because they're waiting for a vaccine to come. And how is that the answer? A vaccine is not the answer. Like, people take the flu vaccine every year, but we've still not eradicated flu from this planet, right? We still get the seasonal flu. So a vaccine is never the answer. And I think people want quick fixes and they don't want permanent solutions, maybe because of the effort it takes. Like, if you really decide to make changes to your diet, you have to become really conscious about what you're doing with what you're eating and your food and everything. So maybe that's the reason why there's apathy, but that apathy is what is making things worse. The more responsibility you take for yourself, like, it's easy, guys. It's not that difficult. It's really easy to eat better and to get better internal health. It is we can teach people how to do it in 3 months. It's like a lifetime of bad habits your body can quickly recover from in just 3 months. And we'll be done with this pandemic, we'll be done with these lockdowns, we'll be done with all of that if we just all of us focus on our own bodies, taking care of our own health and doing what we're supposed to, instead of waiting for external things like vaccines. So that's all I wanted to say. Like I said, I thought of coming live because of the data that we were seeing in our research paper, that in 3 months, we've managed to reverse diabetes in so many people. And you do that and your internal health is really in a good place. Of course, when we have diabetes in people, we're also taking care of their other nutrient deficiencies. We're making sure that their toxin load is reduced. So all of that ensures that you don't really have to be worried about a virus affecting your health and taking you off from this planet before it's time for you to leave. You really don't have to worry about that. And that's the only message I wanted to leave. If you want to reach out to us, just ping me here, just leave a comment if you know someone. So we're also running the study. We're doing this clinical study for people whom we call long haul COVIDers, who, like I said earlier, they've had the infection, they've recovered from it, but they just can't get their energy back. So we are doing dietary interventions with them and showing them how much can change with few changes to what they're eating, what they're putting into their mouth, and maybe supplementing with a few essential nutrients. So we are doing that clinical study. If you want to volunteer, if you had COVID and you recovered, and if you want to volunteer, or if any of your loved ones would want to be part of that study, you can please ping us and let me know. We are not even charging people for doing that. So we are doing the study voluntarily, so that we can just prove to the world that it's really easy, and there's no need to be afraid. So we'll really work with anyone's health there, as long as they meet a few qualifying criteria that they should have been hospitalized with COVID, and then they're having all the other symptoms that come after a long hospitalization, and they'll be working with them for free so that we can publish this data and show people that it's really metabolic health that matters. So if you know someone who'd qualify, please refer them to us. I'd be very, very happy to take them on board and help them out. All right. Any questions that you might have? I can see a few comments on the Facebook Live. COVID is just a disturbance by state. Yeah, I mean, yes, like I don't want to get into that. My feed is full of my conspiracy theory posts. But the point is, there is a virus for sure. There is a respiratory virus. And it is impacting people in the way it is impacting people. Now, people have been scared by media about it being something that's beyond what it is. And my job is to just tell people that you don't need to be that afraid. So that's about it. Right? And if you're watching this later and you have a question to ask or something, please leave a comment and I'd be very, very happy to answer. Hi, Vriddhi. I'm glad you agree that what I'm saying is true. All right. So bye-bye, guys. And I'll see what I want to. If there's something else you want me to talk about, like thyroid or something else, I'll come and do that as well. All right. Bye.